Together we achieve victory over heart failure.
Hello everyone, I'm Dr. Santhosh, interventional cardiologist from Jayadeva Institute of Cardiology, Mysore unit. Today we are here to discuss about a few insights on heart failure. There are lots of myths and confusion regarding this entity. This has been a silent epidemic in majority of the countries, including ours. Hence, it's very much essential to understand, combat this silent epidemic, which is known as heart failure. Majority of the patients who are suffering from heart failure in our country surprisingly are young individuals. It's a common occurrence to witness young adults seeking medical assistance for heart failure, unlike the Western population, where heart failure is predominantly a disease of elderly. Let's talk about this heart failure. When an individual is diagnosed with heart failure, it looks like as though it's the end of a life. Term heart failure, especially when you use the word failure, it gives a frightening feel, but it's not the end of the life. One should understand what exactly the heart failure is. It's basically inability of the heart to pump sufficiently the blood to meet the metabolic demands of the body. There are multiple reasons, the multiple ways to treat it, and a lot of times we can cure it. It is defined as lower pumping capacity, and on evaluation, they'll be given a value called as the ejection fraction, which is nothing but the pumping capacity of the heart. Lower the pumping capacity, more severe the disease is. But whatever said and done, normal pumping capacity does not mean patient is out of danger when it's been diagnosed as heart failure. One more thing, what you should understand is why we Indians are suffering from this heart failure at a younger age. We should understand there are a lot of geopolitical, metabolic, genetic things which matters. We Indians are more prone to metabolic diseases like diabetes, obesity, hypertension. Gradually, tobacco consumption is increasing day by day, especially in a rural population. All these things making us suffer from this heart failure at a younger age. What are symptoms of heart failure? How to identify this? A lot of times in the initial phase, the patients may not have significant symptoms. They may come with vague symptoms like fatigue, confusion. As the disease progress, the symptoms will be more obvious. They'll come to us with breathlessness, lower limb swelling, unable to take breath, pounding heartbeat, symptoms increasing on lying down. All these symptoms are suggestive of heart failure. We need to evaluate these patients and treat them accordingly. And how to prevent this heart disease or heart failure? See, as golden rule applies to any heart disease, identifying heart failure at the earliest is the most essential. We need to modify the diet. They should take less amount of fluids. To prevent heart disease, they should exercise regularly, maintain their stress level, avoid tobacco consumption or alcohol. Once a disease diagnosed with disease, there are a lot of medications which can improve or even cure heart failure. We should identify what is the cause of heart failure, what has precipitated heart failure, treat it accordingly. Nowadays, there are a lot of advances in heart failure treatment. There are a lot of procedures or device therapy called as a biventricular pacemaker or a left bundle area pacing, which can rectify the underlying problem, which is more of a electrical problem, and can rectify and cure this disease. And in addition to that, there are implantable devices like implantable cardiac defibrillator or CRTD. And in some specific condition, they may require surgery either to cure the underlying blockades or to repair the heart valve. Or at the end of the day, if nothing works out, there's a last resort. Heart transplantation is the cure for majority of the terminal heart failure patients. Hence, we need to identify the cause, identify the precipitating factor, treat it accordingly. Majority of times, medications and procedures can cure these patients. If we can't, as a last resort, heart transplantation is a boon for these refractory heart failure patients. And how common is this heart failure condition? It's very common. It is said that 1 in 5 individuals in their lifetime can have this problem. Hence, awareness, identifying at the earliest, treating as early as possible can combat this silent epidemic so that we can come out of this dreaded medical condition which is causing a silent epidemic. Thank you.